Hi everybody, welcome back to my channel. This is Sagnick Dutta. I'm a third professional MBBS student at Burdwan Medical College and Hospital, West Bengal. In this video, I really want to talk about one particular subject of second year of MBBS, and that is microbiology. And the reason why I really want to talk about this subject is because this is one of the most dreaded subject for all the students of MBBS out of all the 19 subjects. And that is the reason why I really want to focus on this subject in particular and talk about how you can actually prepare well for this subject and prepare for its examinations as well. Now, I'll just take a small story. That is, when I actually went for my first semester examination of second year of MBBS for the microbiology Viva examinations, I was asked one question, that is, what are the enzymes that are being produced by the bacteria called as Burkholderia? And trust me, I didn't have the slightest idea that there even exists a bacteria named Burkholderia, and how is that even relevant? But fast forward to that final MBBS examinations of second year, I scored 211 out of 300, which is basically more than 70% of marks, and that is a pretty good marks if you just consider about the examination system in MBBS. Now, keeping all these things aside, in this video, I really want to talk about the preparation tips and how you should actually approach this subject for a better performance in this subject. So without much ado, let us get into this video. Divided this entire video into three sections. In the first section, I would really talk about the resources and how you should actually approach this subject at its very first place. In the second section, I want to talk about the revision strategies, how you can actually revise these subjects. And number three, the third section, I want to talk about your approach towards the examination for this subject in particular. Now, coming to the first section, that how you should actually approach this subject. The first thing that I really want to talk about is the books that you should refer to for this subject. If you have seen my previous video of the resources of second year of MBBS, where I've talked about the books of every other subject, I've mentioned a book called as Apurva Shastri. And in this video itself, I want to again mention the same book, that is this book called as The Essential of Medical Sciences by Dr. Apurva Shastri. And why I really want to focus on this book is because this book is too simple. You can just read it, the language is simple, and you can understand every single bit of everything that is being written on this book. Number two, what I really want to talk about this book is to the point. You can directly learn from this book and write your answers. So this book is exactly what you need for your examinations. And another book which I really want to talk about, and that is particularly for parasitology, is this book called as Medical Parasitology by Dr. Arora. This book of Dr. Arora is something very beneficial for you to understand the section of parasitology in case of microbiology. This book is simply written in parallel to Apurva Shastri for the section of parasitology, which is, I feel, not so good in Apurva Shastri. So you can actually refer to this book of Medical Parasitology for microbiology. Once we have talked about the books, I want to talk about the video resources. Whatever platform you join in your second year of MBBS for your video resources, I feel those are not required. Whether it is Marrow, PrepLadder, or the platform that I joined, that is Cerebellum, I feel the microbiology videos are not actually required. And why I actually say this is because the videos are informative. The subject in itself are informative. So any teacher, whosoever it might be, would actually present to you the informations arranged in their own patterns. So the subject overall becomes very monotonous. So if you read books and make your own notes, it becomes way more interesting. Now, with this being said, I really want to talk about how you should actually make the notes for this subject in particular. Now, if you just see the syllabus of microbiology prior to 2019, when the CBME curriculum was introduced, you would see that people used to teach this subject organisms wise. That is, first they used to deal with bacteriology, then virology, parasitology, and mycology. But from the year 2019, when the CBME curriculum was introduced, what happened was the systemic methodology was introduced. That is, you should approach the subject system wise. That is, you should first for example, if you just take the respiratory system, you would learn the bacteria, then the virus, then the parasites, and the fungus that affects the respiratory system. But it becomes way more difficult to approach this subject system wise, and the reason for that is simple. For you to approach a subject system wise, you need to understand the basics of that particular system, the physiology of the system, the anatomy of the system, and even the pharma and medicine of the system. And that is when you actually can approach the subject organism wise, the causative organisms. So it becomes a little difficult. But if you just approach this subject organisms wise, that is, if you just complete the entire bacteriology, then the virology, it becomes way more easier. So most of the platforms, be it Cerebellum, Marrow, or PrepLadder, they approach it organisms wise even now. And even our teachers in our college recommended us to actually approach the subject that way, so that it becomes easier for us to understand. And that is when this book of Apurva Shastri becomes even more significant. Though the organisms are given system wise in the book of Apurva Shastri, the organisms have got a separate entities in the same book itself, so you can even read it organism wise from the same book itself. So Apurva Shastri is a very relevant book in this category. Now, having said all of these, what I really want to focus upon is the next section, that is revision. As I said, when you just read the books, you should make your own notes. I'll just take each and every organism and talk about. For example, if you just talk about the bacteria, the portion that is very important and very vital for each and every bacteria is its laboratory diagnosis. Under laboratory diagnosis, what you should actually remember is, number one, the samples. What are the different kinds of samples that you can take, whether it is a blood sample or a sputum sample. Second is the culture medium, where you should actually culture the organisms, and different organisms have got a different culture medium. Number three are the staining procedures, or the different kinds of laboratory states, whether it is a if you do a gram stain, whether it is gram positive or negative, if you do a Zn stain, whether it is acid fast or not, or if you just do some other kinds of specific tests for each and every organism. For example, the Weedel test, which is being done for the Salmonella typhi. For these, you need to remember every bit of this information pertaining to the laboratory diagnosis in case of bacteriology. When it comes to virology, apart from the laboratory diagnosis, what becomes even more important is their genetic constitution, the genetic makeup of the viruses, how they actually replicate inside the human body, how they affect the human body. Now, for the things like parasitology, what becomes even more important is the life cycle of the organisms. At which stage of their life cycle are they infecting the human beings, or what are the different kinds of hosts for each and every parasite, the definitive host, the infective host, whether it is an accidental host or not. All of these things become very important. So when you are actually reading a book, or if you are considering watching a video, what you should do is make your own notes, where you should jot down every laboratory diagnosis for every other bacteria at one place, talk about the genetic constitution, the infective mechanisms, the replicative mechanisms, and the laboratory diagnosis for the section of virology, write about the life cycles and the hosts for every other parasite. And what I really want to focus about mycology is, it is, I feel, the most difficult out of all these. The other three sections are bulkier. They have got numerous bacteria, viruses, and parasites. But in case of funguses, the number of fungi is way too less as compared to them, but it becomes very difficult to actually remember their names, because their names are tough. That's it. So if you just talk about the mycology, what I recommend you to do is read according to the questions that are being asked, and that is what I actually did. I took the last 10 years question papers. I marked the important sections that are being asked. For example, classification of fungi is very important. That you should learn by heart, read it multiple times, and bring it to the tip of your tongue so that you can write it very fluently. So mycology is something which you can actually approach this way, that you learn according to the questions that are being asked, because the other three sections, that is bacteria, viruses and parasites, are too heavy that 70 to 80% of the questions are covered from these three sections. But for fungi it is way too less, but it's difficult to remember, so target it only portion wise, the portions that are being asked in your examinations. Now with this, I come to the last section of this video, that is how you should approach your examinations. Now as I said, the fact remains that microbiology is an informative subject. There are a lot of informations which you will have to learn. So it is better that you approach the subjective evaluation more as compared to the objective evaluation. And let me explain how it actually helps. For example, if you just take a long question for your university examination, they would give you, for example, a case of typhoid, and they would ask you to identify the causative organism, and then they will ask you the laboratory diagnosis, then they will ask you the different kinds of particular tests that are being done for these organism, and then they will ask for the treatment procedures, and then they will ask the management procedures. Now if you just consider this question and this organism, what you get at the end of the day is you learn the entire subject in its proper way and understand every bit of that and remember every bit of that. But if you just actually focus on its objective aspect, if you only practice the objective questions, what you tend to do is, maybe for bacteriology you focus more only on the laboratory diagnosis, because that is the sections where the questions are asked mostly from in case of bacteriology. So what you should actually do is focus on the subjective questions first and then focus on the objective questions, and that is what boosts up your preparation more as compared to others. So I would actually recommend you to focus more on the subjective part of this subject. Now having said all of these, I come to an end of this video. I would attach a document in the description box of this video. You can just go and download it, and you would be able to see the list of all the important bacteria, viruses and parasites that are very important for your exams, and even the topics of mycology that are important for your exams. You can just go and download it and refer to that for your exams. Now if you really like this video and feel that it is helpful, please hit the like button, subscribe to the channel and share this video with whomever might find it helpful as well. Thank you. See you in the next one.